So, what does it really mean to be a professional caregiver? It's one of those roles we all think we understand, but today we're going to go way beyond the surface. We're diving into the deep toolkit of skills, the core philosophy, and the incredible resilience this essential job actually demands.
All right, let's just start with a number 75. Any ideas what this is? It's not an age, it's not a speed limit. It is the minimum number of training hours someone needs to become a certified home care aide. 75 hours before they even walk in the door. Right off the bat, that tells you something huge. This is not some unskilled job, not even close.
And that really brings us to the big question here. If it takes that much training just to get your foot in the door, what does it actually take to be a professional caregiver in this day and age? As you're about to see, it is about so much more than just having a good heart and a desire to help. It's a complex, demanding, and incredibly skilled profession. To really get it, we have to start by kind of shifting our whole perspective. We need to move past this idea of a caregiver as just a helping hand and start seeing them for what they are, a trained professional who operates with a very clear guiding principle. Because, you see, at its heart, modern caregiving isn't just about a list of tasks you check off. It's actually a whole philosophy, a specific way of thinking that shapes every single interaction, every decision, and every single action a caregiver takes. And that philosophy? It has a name: person-centered care. Now, this isn't just some buzzword. It is, without a doubt, the single most important tool in a caregiver's entire toolkit. It's the foundation that everything else is built on. And just look at what this philosophy is all about. The goal here isn't just about keeping someone healthy. It's about their choice, their control, their happiness. It's this massive shift to seeing the client as a whole person, someone with a life, with preferences, with passions, not just a collection of medical problems. This, right here, perfectly illustrates the daily balancing act they perform. Over on the left, you've got what's important for the person, the non-negotiables that keep them safe and healthy, like taking their meds. But on the right, you have what's important to them, the stuff that actually brings them joy, like waking up when they want to or eating their favorite comfort food. A truly great caregiver doesn't just live in that left column. They're constantly trying to find that perfect balance that honors both sides. Okay, so if that person-centered philosophy is the foundation, let's start talking about the actual tools. We're going to look at the huge range of practical skills a caregiver has to master. This is the rest of their professional toolkit. Just take a second and look at the sheer breadth of this list. I mean, we're talking about everything from clinical level skills like infection control and managing medications, all the way to understanding the legal complexities of client rights. And then you have the crucial people skills, communicating effectively with clients, families, and entire medical teams. This isn't just one job, it's like 5 jobs rolled into one. So, with those 75 hours of training and a curriculum that covers all of this, a professional caregiver is, you'd think, ready for pretty much anything. They have the protocols, the skills, the knowledge. But what happens when the crisis isn't the client's health, but a complete failure of the system they all have to rely on? This is the part of the job that no training manual can ever fully prepare you for. These are the moments where a caregiver has to completely switch gears. They have to improvise, they have to advocate, and they have to push back against these huge external roadblocks just to get their client the basic care they need. I mean, think about it. If a client falls, the training is crystal clear. You follow a protocol, right? Step 1, assess for danger. Step 2, provide comfort. Step 3, get help through the right channels. It's logical, it's step by step, it's designed for a medical crisis. But what about this kind of crisis? You're trying to get essential services for your client and you hit this wall. There is no 3-step protocol for this. No amount of training in nutrition or fall prevention prepares you for a system that just isn't there when you need it. And this is where the caregiver's role has to transform from a skilled professional into a relentless, creative problem solver. Dealing with medical emergencies one minute and fighting with broken systems the next, day in and day out, it takes a massive toll. So after all this intense focus on the client, the training manual does something really smart. It turns the focus inward, to the well-being of the caregiver themselves. The curriculum is very direct about the hidden costs of this job. It's not just physically hard. The role comes with incredibly high stress levels, a very real risk of total emotional burnout, and the complex challenge of navigating loss and grief as a regular part of your work life. And this is so, so important. Self-care is not presented as a luxury or some kind of weakness. It is taught as a critical professional skill, just as vital as knowing how to prevent a fall. Understanding your own limits and knowing when you need to ask for help is absolutely essential to being an effective and sustainable professional. So when you put all of these pieces together, the guiding philosophy, that deep technical toolkit, the grit to navigate broken systems, and the wisdom to practice self-preservation, a really clear picture emerges. The modern caregiver is a highly skilled professional, a creative problem solver, and an unbelievably resilient human being. And that really just leaves us with one final and, I think, very important question to think about. This work is absolutely essential to the fabric of our society. It allows our loved ones to have dignity, independence, and quality of life. So the question we have to ask ourselves is, are we, as a society, giving these professionals and the work they do the value it so clearly deserves?